Hello, everyone. Thank you for joining us for the monthly Strengthening Families Networking webinar. Today we're talking about working toward well-being, community approaches to toxic stress. I'm very excited that so many people were interested in the topic today, and we've got a great group joining us. So with that, let's jump in. Our agenda today, I'm Kaylin O'Connor from the Center for the Study of Social Policy. I will share a couple of quick updates. Then Martha Reeder will share some updates from our co-host, the National Alliance of Children's Trust and Prevention Funds. And then we will get into our topic. I will share some about CSSP's perspective on protective factors, toxic stress, and well-being, and specifically share content from our new issue brief called Working Toward Well-Being, Community Approaches to Toxic Stress. And then we're going to hear from our friends and colleagues at First Five in Ventura County, California. They'll be talking about Neighborhoods for Learning and their approach to toxic stress in their communities. They were part of the group that developed the issue brief that came out, and so I'm very glad they can share today about their local work. So with that, I'm going to jump in and start with the updates from CSSP. So I wanted to share a little bit for those of you who may not usually participate in these webinars. This is a monthly webinar. It's an open invitation to anyone who's using the protective factors framework in their work, particularly those who are coordinating strengthening families efforts, whether that's at the state or community or agency level. We convene these in partnership between the Center for the Study of Social Policy and the National Alliance of Children's Trust and Prevention Funds. We work together to coordinate topics and get guest speakers, all on topics that are closely related to implementation of the Protective Factors Framework. We often ask for volunteers from the Strengthening Families National Network, either to speak about your work in a particular area or to coordinate a webinar. So if there's a topic that you'd like to share information about, feel free to reach out and let me know. And also just to make sure everyone knows that we do have recordings and all the materials from past webinars, quite an archive that's at this link below. We record the webinar every month. If you are registered for it, you will get a follow-up email that includes a link to just the recording, but you can also always go to this Google site where the slides are also posted and any handouts. A couple of webinar tips. If you're having trouble connecting, then the most important or the most common problem is a difference between whether you're calling in or using the microphone and speakers on your computer. So if you toggle between those, see which one works best, call in and disconnect from the mic and speakers part, or just use the mic and speakers. And usually that will solve your problem, or hang up and call back in. If you're having trouble, type into the chat box, and our helpful colleague Trish Hallmark from the Alliance will try to help you solve that problem. Okay, a little preview of our upcoming webinars, and you can actually see the link there to register now for June's. That'll be on June 9th. The Alliance National Parent Partnership Council will be sharing about their work to build protective factors. And I think that's going to be really exciting. They're a dynamic group of parents who are really passionate about their work, and I'm excited to hear what they're going to share. July 14th, we'll hear about the Early Childhood and Health Learning Collaborative, which is addressing social determinants of health and using a protective factors approach in a lot of their work. So we will be hearing from the American Academy of Pediatrics and their part. I'm sorry, I'm hearing some background noise. Let me know if anyone needs to tell me something. So we'll be hearing. Okay, we got quite an echo going now. I'm going to mute one of our other panelists where the echo may have been coming from, and hope we can sort that out. Our August 11th topic is still to be determined, but just know that we always do it on the second Thursday of the month, so you can put that in your calendar, and once you find out the topic, you can register if it's one that you're interested in. Also, feel free to share these webinar announcements that come out in our monthly Strengthening Families newsletter with others who might be interested. And there you go. There's the URL to use to be connected to our newsletters. We have a newsletter just about strengthening families. We have one about our Early Childhood Learning and Innovation Network for Communities, which we'll be talking more about today, and other topics that may be of interest to you from CSSP, so check that out. My final little update is to share a request from the network. Some of our partners out in Los Angeles are planning a conference, and we're hoping that we had a video about protective factors that they could share at the conference, and we don't really have a concise one that we've developed. We may put that on our list to do at CSSP, but in the meantime I thought, well, let's find out what other people have, because I know that a lot of you either in your own agencies or partners that you may know of have created videos, and we would love to see what those are. If you could send those to communications@cssp.org or send to me, Kaylin O'Connor, and let me know whether it's something that can be shared more widely. We'd love to kind of spread the word and tell people what's out there, both because you might be able to use someone else's video or because you might get some inspiration for making one that's relevant to your own community. All right, with that, I'd like to hand it over to Martha for some updates from the Alliance.
Thank you, Kaylin, and good afternoon, everyone. You can go to the next slide. The first thing I want to do is give you an update on our training and the upcoming training of trainer events. The training, if you aren't familiar with this, is an expansion of our online training that is free on our website. So if you go to the Alliance's website, www.cpfalliance.org, and look under training, there will be all sorts of information there for you to learn more. This is an in-person, face-to-face training of trainers, and we'll be in Salt Lake City next week. But later in June, we have a training in Madison, Wisconsin that the registration is still open for that event. And then later on in the summer in Columbia, South Carolina. And we just opened that registration up this week. And if you're interested in in participating in any of these, you can check these registration links out on our website or contact me directly. I'll be glad to talk to you about it. So can we go to the next slide? The Alliance has an exciting new series of resources that we're just beginning to come and share with everyone. And the first thing in this series is a 30-minute quick webinar that is literally just packed with all kinds of information about the first statewide Pay for Success initiative in South Carolina. And this is sometimes called social impact bonds. It's a very quick way to catch up to speed on this exciting initiative that is a combination of public and private partnerships. And in South Carolina, this initiative is going to help expand an evidence-based home visiting program to 3,200 first-time low-income mothers during the next 6 years. So it answers some questions about this particular initiative, but also about how this strategy might be something that you want to consider. So please look at the link, and I will include a link to that in our materials for our download on the call today. Let's go to the next slide. And this is the last thing I have to share with you today. Just wanted to revisit what Kaylin just shared, is that the Alliance National Parent Partnership Council will be presenting on our call in June on the same call. And it will be Parents and Protective Factors, Need to Know Tools that Help Make the Most of Everyday Moments. So in their words, they want to just pose this question to you. Have you ever wondered about just simple tools that parents need to know about when it comes to building protective factors? And really kind of grasping onto the everyday actions that are part of the framework. These everyday moments provide many opportunities for parents to discover what works best for them. And that's what the parents on our council are going to be sharing with you during next month. And I wanted to be sure and invite everyone to come back and participate on that call as well. So that's all for today, Kaylin.
Thank you so much, Martha. All right, we're going to dive into our main topic for today, which is working toward well-being, community approaches to toxic stress. If you look in the webinar panel on the right side of your screen, you should be able to see one of the options is handouts. If you click there, you can actually download this issue brief that I'll be talking about. It's on our website, of course, as well, but I thought you might want to have it in front of you while we're talking today. And so take a look at it there. This issue brief was just released last month, and it's really describes CSSP's current thinking about toxic stress and what's happening at the community level to do something about it. So I think we all know, we're all aware if we're in the early childhood field, that knowledge about the impact of early trauma and toxic stress is expanding. It's a very hot topic for very good reason. But we have some concern about the direction that conversation tends to go. So we want to shift that conversation a little bit. We are pleased to see the attention and the understanding that trauma and toxic stress are widespread and that they have far-reaching impacts. We need to have a conversation that's not just about individual toxic stress, but about what that looks like at the community level when both when stressors are present at the community level and when communities have large concentrations of people who are dealing with different types of stressful situations and perhaps living out some of the consequences of experiencing toxic stress. So we want the conversation to be about more than understanding what toxic stress is, and we also want it to be about more than intervening when someone is experiencing a toxic stress response. We really want to talk about root causes of toxic stress, about what's happening in communities and in families, and what we can do as parents, as caregivers, as service providers, and as policymakers and system leaders to make it less likely that people will experience toxic stress. That means reducing stressors, identifying those root causes, and tackling them. It also means helping parents better understand how to buffer children when there are stressful situations around them to avoid it becoming a toxic stress situation. And about building protective factors in families and communities so that that buffering is more likely to happen when stress is encountered. So there are emerging community-level strategies to address community trauma and promote community healing and resilience, and that's part of our bigger conversation. So we went into, we carried all these thoughts and questions with us into what we call a learning lab process. It's part of our early childhood link work that I mentioned earlier. We sometimes call it EC Link for short. The link stands for Learning and Innovation Network for Communities. This is a group of 9 communities that have strong track records in early childhood system building, who come together, convened by CSSP, but very much with leadership from the communities, come together to talk about priority issues that they're facing in their early childhood systems work, to share the strategies they're using and what challenges they're facing. And then through these learning lab processes, we bring them together to explore an issue, recommend some next steps, and those should be next steps that inform their own work as well as the rest of the field. So we want them to be getting something out of this for their own community work, but also to produce things like this issue brief that we believe are useful for others too. So the Learning Lab on Community Approaches to Toxic Stress met monthly for 8 months. Ending in, well, I guess starting at the very end of 2014 and into about the middle of 2015. We had 6 communities that chose to participate in that learning lab. The first step was to define toxic stress from a community perspective. I'm going to share that definition in a moment, and then we'll get into sharing the framework that was eventually developed through the learning lab to really put toxic stress in the context of broader work on well-being. So the first thing that we did was to define toxic stress from a community perspective. So really where we started was saying we're not the clinical experts and we're not the brain science experts, although we work closely with those people and we want to stay connected to that work. But at the community level, what are we doing with this knowledge of toxic stress? How can we define it in a way that captures what we need to be thinking about at the community level, which is different from what we need to think about when we talk about intervening with individuals, with doing clinical work, or with exploring the science of toxic stress. We wanted to really get into what it means at the community level, why it's of concern, and how communities can respond. So we have a handout on this. The definition is also incorporated into the issue brief that I'm sharing, but the handout came out first because it was the first step in the process. And I'm going to talk a little bit about where we landed with that definition. So it's a 5-part many sentence definition, and really talking about what toxic stress is all about. So we start by talking about a toxic stress response, just defining it as the strong, frequent, and or prolonged activation of the body's stress response system without adequate protective relationships. And we list what some of those stressors can be, with an important emphasis on the fact that those can be individual experiences as well as family and community circumstances that cause a sense of serious threat or chaos that throws the body into that stress response system. We then go into what the effects are, that it can be seen in a wide range of poorer outcomes. We're always very careful to emphasize that these are not necessarily always, these poor outcomes don't always result. So we say left unmitigated, these effects can occur over the course of an individual's life, and we can even see them going through subsequent generations with epigenetics. So really, one key takeaway from all this work is that we need to be really careful about not saying that toxic stress in a deterministic way will cause poor outcomes, because we know that's not true. We know there are routes and pathways to resilience. We don't know exactly what those are. We have some ideas. We have the protective factors framework that we think is a key predictor of better outcomes, but we do know that there is resilience, that a lot of people have experiences that could be categorized as toxic stress who may not have the negative outcomes later on, and so we don't want to be deterministic about that. We then go to the next one. A toxic stress response in pregnant women, infants, and young children is of particular concern because of the rapid brain development going on at that critical period. And again, that these toxic stress in those periods can have far-reaching effects. Then we wanted to be sure to underscore that not all stress is bad. We're not saying that no one should ever have any bad experiences. Going through stress and adversity is part of how we learn and grow. It's inevitable, and it's in many ways often positive. But when we get into toxic stress, it's a different creature, right? We're talking about something that's actually very different when it has that effect of strong, frequent, or prolonged activation of the stress response system. So that can vary from one individual to another. What would trigger a toxic stress response in one person may not in another, and it may depend on what other experiences that person has already had, what kind of buffering relationships they have around them, what kind of community they live in, whether they get support they need. But we are very concerned about chronic exposure to stress and adversity because it can have that cumulative toxic stress effect. And finally, we end our definition with talking about the role that safe, stable, nurturing relationships and communities can play in buffering children, particularly young children when they experience adversity that does not need to become a toxic stress response when we are able to provide the right buffering around them. I see that a couple questions are being typed in, which I always appreciate. We're going to, I'll stop to take questions when we get to a sort of natural stopping point in the presentation. So feel free to type those in, or you can raise your hand in the webinar and we'll know to unmute you so that you can speak when we get to that point. So with this learning lab process, after we had done the definition, we started thinking, what are the key questions that we need to be asking at the community level? These are different from the scientific questions that are continuing to be explored. Our partners at the Harvard Center on the Developing Child are leaders in this. There are a lot of researchers around the country and around the world who are really figuring out, what exactly, how can we better understand what toxic stress is? How can we better predict outcomes? What are factors of resilience when we really get down to the scientific level of neuroscience? That's all really important, and we fully support people doing that work, but we think there are a different set of questions at the community level. So I think I'm going to go through these questions relatively quickly. They're each expanded on in the toxic stress issue brief that I encourage you to take a look at. So one question is about what are we already doing in our community to prevent the conditions that can generate a toxic stress response. And so what's going on in terms of prevention programs, what's going on in terms of community organizing to tackle sources of stress in the community, And then what level of coordination of these activities is already in place. And related to that, of course, we always have to ask what additional services, supports, or opportunities could enhance those existing efforts. And then we want to keep in mind always, how might an understanding of toxic stress, which is an ever-growing understanding, how might that lead us to change the way we go about our current work? I think a lot of the conversation about toxic stress ends up going towards how do we intervene? How do we help children or adults who have experienced toxic stress? And that is a very important question. But we also need to think about how does that understanding change any of our current efforts, whether they're around prevention or around how we talk about why we do prevention work or why we do the type of education we do or why we take any of the steps we currently take. We can make the case for it differently because of toxic stress. We can approach it differently because of toxic stress. We can change disciplinary strategies in schools and in early care and education programs based on understanding that sometimes those acting out behaviors are a result of toxic stress. And whether they are or not, we know there are effective ways to respond that we're learning from our understanding of toxic stress, which may help to manage behaviors in classrooms, whether we know for sure that a child has experienced toxic stress or not. So another critical question, which gets very much at our Strengthening Families approach, is where do young children and their families spend their time? So where can we find the young children and their parents who we want to talk to about these issues, who we want to engage in programs and engage in community organizing and engage in whatever efforts are going on and what opportunities are available? Then another question is, what are the greatest sources of stress in children's environments or threats to children's well-being in our community? And often I think those of us who are having the conversation about toxic stress are not the same people who are talking about those sources of stress in children's environments. So maybe there's a disconnect. If we're really focused on early care and education, that's incredibly important work, but we may need to make more connections to what's being done about racism in our communities because we know that's a huge impact on children's well-being and their families' well-being. And with that broader understanding of children's well-being and how toxic stress plays into it, we may decide that that's somewhere else we need to be working, and those are other professionals and community members that we need to be connecting with are the ones doing work on other issues that are sources of stress in our children's lives. Finally, I think we always need to think about when we start to identify some solutions, which ones can be single sector? So which ones can we just take on as a human services agency? And which ones need to be cross-sector? So where do we need to engage new partners or even just work differently with partners that are already sitting around some of the same tables? But there are some solutions you can just implement, and there are others that take longer collaboration and planning, and so thinking carefully about which solutions you have in each of those categories. Okay, so I'm going to move into sharing the framework that was developed that's sort of the heart of the issue brief. So this learning lab, there was a moment when we were all talking about, okay, so all these things need to be in place, and we really want to think bigger picture about children's well-being and how toxic stress is plays into that, but is not the whole picture. And someone said, I think maybe we need a logic model. So that's where we started thinking about this framework and really trying to put things down in writing to get it with a little bit of a flow from one side to the other. So I'm going to go through this really discussing what's in each part of the framework, and I encourage you to ask any questions and dig in. And let me say one more thing before I dive in to the individual pieces of this, and that is that we phrased this to incorporate or encompass so many different types of work that, of course, it's not going to have the detail that an individual service provider might want for figuring out what they're going to do, for example. That's intentional. We will be diving in on some of the sort of pathways through this where individual providers or an individual group of parents or caregivers is going to get activated and do something that really lights up parts of this framework and goes into more detail on them. And I encourage you to do the same, to think about where your work fits in and how which parts of it that you have an influence on and how you can really flesh that out in more detail. So we start with what we call agents for change within a community system. And there are three categories that we talk about here. They're parents and caregivers, service providers, and then the multi-system community partners and policymakers. So I'm going to talk about each of these in turn. We start with parents and caregivers. We intentionally put them first in the framework because often they're not the first group we talk about in this kind of work, but they are so critical. And so we want to see, and we do see in a lot of communities, parents and caregivers organizing to develop strategies to prevent and respond to stressors in their families and communities. So really deciding and determining what to do within their own communities and within their own families. Really digging in on learning and sharing strategies to respond to the impact of toxic stress. So the first one was more about prevention, but also responding to the presence of stressors. And then the second one is about responding to the impact of toxic stress when it is real in their family. And then developing leadership skills and partnering with the other agents for change, because that's where we think that that systems and service providers can really get activated to make significant changes when they're engaged by parents and caregivers who have come together because they need to see things change. So the next group of agents for change we talk about are service providers. I think that's a lot of who we typically reach with our Strengthening Families messaging and a lot of our other work at CSSP. So we want providers, working together to build awareness of toxic stress and really working on, again, promoting healthy development and preventing stress, but then also effectively screening and assessing what's going on in families to identify needs for services, which may or may not be directly related to toxic stress, but that are arising and are threats to children's well-being. And then responding to intensive needs appropriately as well. So talking about that whole range of prevention through intervention. When we talk about multi-system and community partners and policymakers, we want to see greater coordination. And when we do see greater coordination, I think we see a lot better effectiveness. So really trying to engage all sectors of the community and then supporting the program changes and making sure the right programs are available, promoting the policies, practices, and techniques that will mitigate stress and promote healthy development, and developing and implementing financing strategies to make all that work, because we know that as much as service providers or even agency leaders might want to do more innovative and cross-system work, without the funding in place to do it, it can be really difficult. So we need leaders who are going to step in and make the financing work. So then we move into what the community context looks like when these actions are being taken by the agents for change that I just talked about. And what we want to see happening in a community is, here we have again, first the parents and caregivers, that they can have opportunities to learn about toxic stress, about positive parenting strategies, and that they have opportunities to make important decisions for their families and communities, so that they are empowered to understand what the effects of these stressors are or potentially are in their children's lives, in their own lives, and in the lives of families around them, and then are empowered to make decisions to change things. When we talk about the professional side of what the community context looks like, we're talking about having an aligned set of services, both formal and informal, and interventions and opportunities that are available both for children and adults. We want appropriate recognition and response to symptoms of toxic stress when it is occurring. But more generally, we also want family-friendly and trauma-informed community entities around. So if you're at the doctor's office, if you're at the grocery store, if you're at your place of worship, we want those places to be family-friendly. We want them to understand also what is going on when we talk about toxic stress. What are some of the things that families are struggling with, and how can we respond in effective ways? We want protective factors to be robust, both at the family level and at the community level, which we believe they are more likely to be when all those other actions are taking place and these other community pieces are in place. The next level is about the individual and family experiences that we think are, we phrase these to kind of capture what we ideally want to see, is that children are growing up in a rich environment of positive experiences. So we're not just talking about the lack of toxic stress in children's lives, because that doesn't get us very far. We want to talk about a rich environment of positive experiences, that they have stimulating experiences. There are adults who care about them. They are getting the developmental interactions that help them make those leaps and bounds that we see in development in the early years in particular, but throughout their lives as well. Then we put that we do want children to have minimal exposure to severe and or prolonged stress, so that they're less likely to develop a toxic stress response, but also that parents and other adults are informed and equipped to provide a buffering service. I don't mean providing a service technically, but provide that buffering so that children don't go into a toxic stress response, but can go through a difficult experience, have some support to process it. And then our last bullet point here is about receiving appropriate support when toxic stress is experienced. We want to minimize that, have it happen as little as possible, but when it is happening or when someone is still living out the consequences of it, we want to have appropriate responses. Finally, we have our very general listing of outcomes where we put healthy development and children and families thrive. And I think depending on what sector you're in, which kind of agent for change you are, what community you're in, and what your goals are, you might articulate those outcomes more specifically and differently depending on where you're coming from. But we put it very generally here because we wanted to make sure that we're putting this all in the bigger picture discussion about child well-being. So we don't want toxic stress to be a conversation that's separate from all those other conversations about how do we improve child well-being. So there's the framework as a whole. I'm just taking a quick look. I do see one question that I'll address right away. Someone asked, how did you come to the decision to use the terms parents and caregivers instead of families? I think in the places where we use parents and caregivers, it's because we really felt that we really mean anyone who's in a parenting role. So that might be grandma, it might be a foster parent, it might be a birth parent, it could be anyone in that parenting role, but we really wanted the focus to be on the adults. So it's I suppose we could debate about the role of youth in organizing for the types of things that we describe here as actions of parents and caregivers, but I think we did that to specify that we're talking about adults and that adults have a particular role in their relationship to children. I'd be curious to hear your response to that, if you think families would be more appropriate there. I'd love to hear about it, but I think we really wanted to stress not to make it just about a biologically defined parent, but about people who are in that parenting role and other caregivers as well. We do have one question of someone asking about, are we going to hear about how all this can happen with concrete examples and ideas? Well, we're going to hear about what they're working on in Ventura County. That will be the next section of our webinar. And you'll see in the issue brief itself, we have examples from many of our early childhood link communities. We don't have examples of the full picture, like we don't describe how everything in this framework is happening in a given community. That would be an interesting but enormous case study. I will say we're also planning a second webinar that will be more focused on what city and county leaders can do to implement some of these ideas and what kind of changes they could make. Because today we're focused on the framework sort of generally and with the strengthening families angle on it, but we'll talk about more the city-county leadership perspective in our next webinar, which will be scheduled soon. It will be in early June, and we'll send that date out once we have it. It'll go out in our newsletters, and I will explore whether I can send it to everyone who registered for this webinar as well. Okay, I think I'll keep going here. I wanted to share the recommendations that came out of the Learning Lab, and each of these is expanded upon in the issue brief, but I want to talk about them just briefly, and then we'll get to the presentation from Ventura County about the work that they're doing. So the first set of recommendations are related to providing information and promoting leadership opportunities for parents and caregivers. And so some of these you could guess from what we've already talked about reaching out with information about all these issues for parents to be able to act on. And again, I'm using parents in a very general sense. Then to really focus on parent advisory groups and making sure that parents are part of the decisions about their communities, particularly here, of course, related to potential sources of toxic stress. But we advocate for parent involvement and resident involvement in problem solving and decision making and programming in every context because we think that people need to be part of the change for the communities they live in, both out of a sense of justice and out of a sense of making things more likely to be effective when you have the people at the table who are going to be directly affected by it, but also because it's just the right way to do it, to engage people in decisions that affect them. We also talk about the importance of creating leadership development ladders and particularly focusing on communities where we have disproportionate exposure to potential sources of toxic stress. We need to not just put up a flyer saying that parents are invited to an event where they can have some input, but really reach out, do that intentionally, provide opportunities for parents to get engaged at a program level or at a building level where they can relate with the people around them and then develop those leadership skills so that they're ready to come and sit at a meeting with the mayor about what needs to happen in their community. We talk about that a lot in Strengthening Families, about engaging parents as partners first in the on-the-ground work with their children and saying you are, a partner in how we get to the outcomes that we all want for this child, and really doing that from an authentic place of partnership as then being able to engage them in other forms of leadership and decision making as you go forward. The final recommendation related to parents and caregivers is about finding those existing groups of parents. We know they're out there. They are advocating for trauma-informed care. Perhaps they are foster parents who are caring for children who have had a toxic stress experience, and they're advocating for better responses to them. Perhaps they're in communities that have had I'm thinking of Flint, Michigan. There are parents there who are advocating for better conditions for themselves and their children. If we can partner with them, that gets us a long way towards finding the solutions that are actually going to work in a community because we'll have the community members there at the table. The next set of recommendations are about supporting and building the capacity of service providers, both to prevent and address toxic stress and then to promote well-being. So, of course, we have the obligatory recommendation about providing more training, but also to provide coaching and mental health consultation for service providers so that professionals have the support and backup to manage these more challenging behaviors that children might present. We all know that preschool expulsion is a problem, and we know that mental health consultation is one way to really make a dent in that problem so that those teachers have someone they can call who's going to come and help them work through how to manage a child's behavior so they can keep them in the program, continue serving that family and engaging with them with the appropriate support. We want to promote the use of tools and strategies that build resilience and promote healthy development so that, again, we're not just focusing on toxic stress, but on more generally, how do we build resilience? How do we help everyone do better? And then for service providers to be part of developing and aligning the services, supports, and opportunities that are available for families in a given community, so that young children's needs are being met, and so that the service providers know who else is out there in their community, who they can refer families to for help, who they can talk to when they're having a rough situation. They need someone to get some professional conversation with. They know who's out there. And then we have a bunch of recommendations. I've had 2 slides of these ones, of some of the recommendations for multi-sector and broad-based collaboration. So one of the important things that we always stress and that we've learned so much about with our early learning communities is about the importance of that convening and connecting role. So someone who's the backbone organization, if you're working from a collective impact frame, but someone who's convening meetings, who's bringing people together, who may or may not have their own services they provide in the community, but they're part of that community network, and they have the role of making sure the work continues to move forward. There needs to be a lot of work done around assessing the needs and assets that are already in the community, asking some of those questions that I went through earlier, possibly doing information campaigns about community awareness. And I think we're learning a lot still about what that needs to look like for community awareness around issues of trauma and toxic stress. Again, that concern about being too deterministic and not acknowledging resilience and not leaving room for hope, because we do know that positive outcomes can still happen, but that the more aware people are of the concern, the more likely they will be to get children the right support they need when toxic stress does occur, and the more we can engage families in productive advocacy and organization to change their conditions. We have a recommendation about developing strategic plans at the community level, working on common goals with shared results and metrics, which that convening role that I mentioned first can be really helpful with in terms of defining what some common goals are going to be and helping negotiate towards agencies being comfortable sharing data and information so that you can really see what effect you're having and be more systematic in your approach. We have a recommendation about balance between prevention and intervention. So both identifying and responding to those who have already experienced toxic stress, that's critically important, but we need to make sure that we also continue working on prevention and promoting healthy development so that we can not have as much need for response later. And then identifying and working on the sustainable funding for these type of efforts. I think we've found in our EC Link communities and in a lot of communities, there are agencies that are able to work really creatively sort of behind the scenes of how they find the right funding to meet families' needs, no matter which service door they might walk through. But we need to make that easier, so you don't need to be a magician to make it work, and find sustainable sources of funding that actually allow agencies to meet families' needs the way they need to be met. Okay, I want to acknowledge the 6 communities that participated in our Learning Lab. We had 3 of our California counties. This is the first 5 commissioned in each of these, in Alameda County, Orange County, and Ventura County, who we're hearing from today. And then we had 3 other participating communities, Palm Beach County, Florida, the city of Hartford, Connecticut, or partners at the city level in Hartford, and then Lamoille Valley, Vermont, which is a region with a very active early childhood system. Now I'm going to stop and see if there are any other questions I should address. Let's see, what are we seeing as the framework is unfolding in the foster care system with all the changes that are taking place in that area? That is a very good question. I think probably more than I can answer right now. This framework is just out, so as we see perhaps the protective factors framework itself being used in the foster care system, there are a lot of interesting advancements. We're actually going to focus one of these webinars on how protective factors are being used in child welfare, which we do occasionally through these webinars. We'll do one again soon, probably late summer or fall, about some of the ways that jurisdictions are being really creative in how they use the protective factors framework to help shift their work. But at this point, I don't really have an answer on foster care with this framework because it is so new. So I'm sorry I can't give a complete answer to that, but thank you for asking. And I will definitely try to take that into account as we plan our future webinars and conversations. I'm not seeing any other questions right now, so I'm going to go ahead and hand off to our other presenters from Ventura County, California. We're joined by Claudia Harrison and Petra Pulse. I'd like to hand off to you. Are you there?
We're here. Can you hear us?
Yes, you sound great.
Great. Thank you. Well, good morning, good afternoon, depending on where you are. We're so pleased and excited to be part of this webinar today. When Kaylin asked if we could share a little bit about what we're doing, we were really excited about applying the framework that you just heard about around how to look at toxic stress from the community lens to the work that we have been doing for many, many years, and really share that with all of you on the webinar today. So before we kind of jump into what we're doing and how we address toxic stress in our community-based service system, I thought it might be important to just share a little bit about who we are. First Five Ventura County is the local agency that administers tobacco tax revenues that were created in 1998 through Proposition 10 in California. There are 58 counties. Each county has a county commission that is similar to First Five Ventura County that was responsible for managing those funds. In Ventura County, we currently receive around $6.8 million, but we have significant efforts in place to leverage funding, so we're actually investing almost $12 million on an annual basis in programs through other dollars that we bring in through grants, foundation funding, etc. Ventura County is just north of Los Angeles on the Pacific Coast. It's a beautiful place to live. We have about 850,000 people living here in our county. 63,000 of our population are children birth to 5. When you visit Ventura County, there are about 10 distinct cities, towns throughout the county, and it's a very interesting mix between urban area, but also a lot of rural and agricultural areas. We have relative affluent populations throughout the county. Our child poverty rate for children ages 0 to 5 is about 16%, but we have, based on some of those geographic differences, significant pockets of needs. In some areas of our county, almost 1 out of 3 children live in poverty. So very, very difficult situation, and lots of stress, toxic stress in those communities, as you can imagine. Next slide. Next slide, Caitlin. Oh, there we go. So our goal with First Five, you heard Kaylin talk a little bit about agents for change within the community system, and some of those agents that she talked about are promoting healthy development for children and preventing stress. And this is really a very nice alignment for what we envision our goals are. We want children to be healthy, and that starts with pregnant women accessing prenatal care. We want parents and children to receive screening in medical offices and community settings, and that includes screening for ACEs and developmental delays or challenges. As we all know, that leads to stress as well. And we want to make sure that children have good health practices. We want to make sure that there's good oral health practices, that children are eating healthy, and that they're physically active and exercising. We want children to enter school ready to learn. We do this primarily through investing in high-quality preschool for 3- and 4-year-olds, but we know that learning doesn't start when children get to preschool. So we invest heavily in our Birth to 3 programming, which you'll hear a little bit later on more detail about. But it's really trying to reach especially those children that are most at risk as early as possible through some prevention, but also early intervention services. You heard Kaylin talk a little bit about parents really being the primary source to either kind of help buffer some of the stresses that children are experiencing. And the way we do that is to make sure that parents have the knowledge and the resources that they need to be the best parent that they possibly can. And that includes making sure that parents have the knowledge of early child development. So there's lots of parent education classes that we're offering, positive parenting services, including Triple P. But we're also wanting to make sure that parents are connected to the resources that they need. And that can range all the way from very light touch referrals to addressing basic needs, food, housing, shelter, access to medical services, and then all the way to some more comprehensive medical interventions. And then finally, communities play a very important role in our work. And we work on making sure that communities are engaged in supporting and prioritizing children. And we do that by really coordinating and bringing service providers and community stakeholders together to make sure that we have a web of support so that no child can fall through. Next slide.
So this is Claudia, and I'm going to just jump in. So the context for really First 5 statewide and for our work locally is really brain research. It's really the knowledge that we have today, which is certainly the knowledge that leads to what we know about toxic stress, is that interactions and experiences matter. And when we talk about this with the community, what we talk about is that what we know from brain research is that what you do matters and what you don't do matters. And so with that, we have a vision of what it means to give our kids the best start in life, and just framed in terms of starting strong. Our tagline for First 5 Ventura County is because the first 5 years impact a lifetime. And we know to do this, we can't look at any one thing. So this slide really summarizes what Petra just went over, but it's how we think of our work. And so we think of, we want strong, healthy children. But to have strong, healthy children, we need strong, healthy families. And for strong, healthy families, we need strong, healthy communities. So it's, if I was more talented, this would be a beautiful graphic with, you know, interlocked circles and all. But I think you get the idea in terms of there's not one piece of this. It's really the continuum of interventions that we need to put together that make it possible for our kids to start strong. I'll turn it back to Petra to talk about NFLs, which is our core initiative where we bring all of these frames together.
Okay, so again, I'm going to go back to what Kaylin mentioned on the in the earlier presentation, where she talked about the key question at community level, the community members at the community level should be asking themselves, and that is where the young children and families spend their time. Well, in their neighborhood, and in their neighborhood where they live most often. So what we did in Ventura County is we created 11 what we call Neighborhoods for Learning, or NFLs, which basically is a community-based service system for early care and education. It's a community-based, nationally recognized model that provides parents with the high-quality resources and services for about 15 years now. As I mentioned earlier, our county is very diverse geographically, but also in terms of income and need factors, as well as in terms of the assets that each of those communities have. And so the families within those communities, within those neighborhoods, really are at the core of how these NFLs ended up being shaped. We knew that families responded best to locally based resources. We knew that they respond best if they have ownership, and that the programs would be just so much more successful. So parents have a very important place at the table when it comes to decision making about each of the Neighborhood for Learning services that are being offered and funded. They are basically local resource hubs that are loosely aligned with school district boundaries. And over the course of the past 15 years or so, they have spawned about 25 family resource centers. Although each of the NFLs has a very similar set of core services that families can access, the way the services are rolled out and implemented varies, really based on, again, the community's needs and assets. One example is preschools. In one community, we may have invested in actually building brick and mortar preschools because there just wasn't enough facilities available. In other communities, there were lots of preschool spaces, and the community decided to address preschool access through scholarships. But again, the end result is certainly the same. What we then do is we work with our community public health agencies and other partners to layer on top of that NFL structure and provide other services that are delivered on a regional basis, such as access to oral health services. Next slide.
So what we'd like to do for just a moment is really to focus in on one of the core things that happen in our NFL throughout the county.
I'm sorry, Claudia, can you get a little closer to the microphone? Some people are having a hard time hearing you.
Okay.
Thank you.
Is that better?
I think it will be, yes. Thank you.
Sorry about that. So what I want to do is focus in for a moment on one of the core programs that we offer out of our Neighborhoods for Learning. And we call them PACT classes. It stands for Parent and Child Together. And it's really our key program for building resiliency and really bringing kids together with their families to create that strong start that we spoke about earlier. So when we started our NFLs about 15 years ago, we really focused much more heavily on preschool. We had just started, kids were aging out, we really wanted to reach the 3 to 5 population, but we realized we were missing a huge opportunity in terms of really starting younger and really using what we knew from brain research. So through a learning community of getting our 11 neighborhoods for learning together, we figured out how to flip the population that we served. So in our early years, we were serving about 65% with preschool 3 to 5-year-old types of services. Now it's 65% birth to 3. And that really happened from a learning community of providers coming together saying this is how we can do it and this is how we can change it. What happens in these PAC classes, I tell people it's like a sophisticated mommy and me. And so I think we all know what mommy and me are. They're multi-session classes. As Petra suggested, they differ throughout the county because the complexion of each of our NFLs is a little bit different and they reflect the culture of that. The focus, though, is on attachment bonding and early literacy in terms of what we're trying to do for the child, but it's really developed and framed around the 5 protective factors framework. We intentionally introduced the framework to our NFLs probably about 5 or 6 years ago through a series of trainings, individual consultations, and peer review. And it's been pretty amazing how it's taken off and how the NFLs really design their curricula to make sure that they're addressing the different aspects of the 5 protective factors. When they get together, they even design their own agendas to make sure that when they're doing their agendas, they're addressing each aspect of the 5 protective factors. We love it. But basically, so in addition to the early literacy and the bonding, when parents come together, there is certainly an opportunity to provide the type of knowledge of child development and parenting that we know is so important. There's the opportunity to also connect parents to other resources. So to the extent that families need referrals, they're having trouble with their basic needs, it's a perfect setting for that to happen. And what's very, very key is the social connections that happen with that. This is really interesting for us, and it's something that we feel like we're on the path, but it's a long journey to really get 100% of the way there. Parents talk a lot about having the opportunity to connect and meet and talk with other parents, how key and important. We know how important that is. And yet, when we do a parent survey, one of the key things for us to look at were parents saying that they felt like they didn't have enough places in their community to meet with other parents. It's key. It's a key part of the framework. It's a key part of what we're doing, and it's key in terms of what we need to continue to do to really build this out more. Next slide. So going from that in terms of social connections and how it's bigger than just the family and just the child, we really do look at, so what do strong communities look like? And what we are finding that as we expand the scope of our work to look at factors that cause toxic stress, like poverty, and Petra talked about some of the poverty in our county, we're really beginning to try to work with city leaders and community leaders and envision, so what does it look like when the community is supporting children? And I don't think anything will be new to most of you on this call, but in terms of supporting parents through quality parenting information, high quality early learning experiences, the social connections that I spoke to before, and the safe communities. We've been working a lot with our Economic Development Collaborative of Ventura County, and one of the things that they talk about and really connects them to our work is how do we build communities where businesses want to locate and families want to live? And we do it by strong systems for families, good quality education, beginning with early childhood education. So this has really begun to form our even larger vision as to how do we bring a lot of the work that we're doing to greater scale, so it's not just within the people who come into our direct service environments, but we really build a community that looks like this. So I'm going to conclude in a second with a very short video. Hopefully, Kaylin, do you know if it's going to play?
Actually, I don't think we're going to be able to play it. We're right at the end of our time, and the sound wasn't working, just so everyone understands. We had a video ready to play, but when I played it, you wouldn't be able to hear the sound. So I was wondering if you might be able to, Petra, if you could put the YouTube link in the chat box. Others will be able to see that. The other thing we can do is send that out with the follow-up email that goes out so that you have a chance to look at it. It's a great video. I'm really sorry we can't show it. The ironic thing is when I went to try to bring it up on YouTube so that I might try to play it that way, it wanted to play an ad for GoToMeeting before it would let me play the play the video, and I don't know how to get past that without making everyone watch the video for GoToMeeting on a GoToWebinar, which would be very odd. So we're not going to not going to be able to show it this time. It is. Why don't you maybe just describe it quickly, and then we can share the link with folks.
Just one word. We got a glimpse last week of what it looks like when a community invests in children and gets excited about that. We had a Take 5 and Read to Kids celebrity reader event. We had over 40 celebrity readers, law enforcement, elected officials, large business owners, from all really aspects of the community, that at 10 o'clock last Thursday morning, they read at public places and in preschools. And I have to tell you, the reaction from kids, providers, and readers created a type of energy and investment in children that we had never really seen before. And so I leave you with this. Please watch the video and then imagine what a community would look like if this type of energy and investment in kids and communities was present every day. Thank you so much.
Oh, thank you so much. I'm so glad you were able to share about your Neighborhoods for Learning and the rest of your work. Really exciting stuff happening in Ventura County. And I want to thank everyone for joining us today. I hope it was useful. I hope you'll let us know what this framework, whether it's useful in your community, what it looks like there. Feel free to email me with that information. And like I said, we'll have another webinar about this in June, and I'll let you know when that is in case there are others you'd like to have participate in it. So thanks everyone for participating. Thanks Martha and Claudia and Petra for presenting, and everyone go out and have a great afternoon and evening. Thank you.
Thank you.